Hospitals around the world have identified a problem with enteral access, which takes up unnecessary time and resources and that puts patients at increased risk. Don't we have the technology to fix this? It turns out we do. We at Pentagon Medical present GastroVision, an innovative, immediate way to verify NGT placement using existing technology. Nasogastric tubes are passed through the nose and down through the esophagus and into the stomach. They are used for feeding purposes and administering medicine. Roughly 1.2 million NGTs get placed every day, and the age range for those who need NGTs varies from neonates all the way up to the elderly. Verifying that the NGT was placed properly in the patient takes up to 4 hours due to the necessity of using an X-ray to verify the placement. This amount of time is way too extensive, taken that there is a possibility that the NGT has been misplaced into the lungs or even into the cranial cavity. In addition, there are a various number of other ways that placement is verified, such as pH testing or aspiration. The process of verification takes too long, is not consistent across the board, and generally requires another method to be able to give an accurate placement. About 2 to 4% of NGTs get misplaced every year. This is around 36,000. A misplaced NGT can lead to a pneumothorax and can be fatal. GastroVision is a novel design of a nasogastric tube that incorporates a metal band at the tip that can be visualized simply by using an ultrasound. Ultrasound imaging is very common, easily accessible, simple to use, and is safe for patients. GastroVision has the goal and the purpose of streamlining the process for NGT placement verification and eliminating the need to use X-ray imaging. GastroVision utilizes the reflective properties of metal to maximize the visualization of the tip of the tube using an ultrasound. The device is made of a polyurethane tube that has a thin band of reflective 316 stainless steel embedded into the tip. 316 stainless steel is known for its biocompatibility within the body, so the product itself is very safe. GastroVision would significantly decrease the amount of time it takes to verify the correct placement of NGTs, and as a result, patient safety would be increased tremendously. Some added benefits include the patient not being exposed to radiation from X-rays, and the placement of the NGT can be easily verified more than once. The cost of GastroVision would be no more than the current NGTs that are on the market. When compared to the cost of Dobhoff tubes and other NGTs, GastroVision would fit right in and even be on the lower side. The estimated cost of GastroVision is roughly $3 per piece, which is inexpensive and well worth it. We are asking for a grant of $40,000 in order to complete a clinical trial. This would be used to cover costs for use of the hospital, compensation for the trial participants, manufacturing of the device, and the related paperwork. Some potential partners we are planning to collaborate with include Atrium Health, Prisma Health, and MUSC. Take this next step with us towards a new era of enteral access.